start with you. I think, given that there are some of the major challenges that the healthcare industry faces, and especially on the lines of infrastructure, in terms of setting up new hospitals and expanding them. How do you think, how effective has been the government policies? Also, what are some of the challenges that you see in terms of, setting up new infrastructures? And if you can
Thank you,
summarize that.
Jagruti. Good morning, ladies and gentlemen. Great pleasure to be here. Let's just start with some very basic stuff. What do we need to set up a hospital? I think the fundamental requirement is land. And land today in our country is becoming very, very expensive, almost unaffordable. If we are able to find land in a location that makes sense, we've got to be very lucky. Otherwise, land availability is a huge issue. If we do find land, the second major problem is the conversion of land use, which by itself is a very major project, that we have. And the third issue is the productivity of the land. That means how much can you actually build on the land? And I think that these issues are areas that we really struggle with on a day-to-day basis. Whenever new projects come in, I think it's a nightmare for any hospital organization. When we start building a hospital, again, we have to access funds which are either one's own or you have to borrow from the banks at normal lending rates. There isn't any special dispensation that the government actually provides to healthcare providers. So if you have to set up a hospital, go and buy it at market, pick up capital at market rates, and then hope that your business model is good enough to enable an effective payback. It's a huge challenge. Second, I think major bucket of issues that we face is around the permissions and licenses. I was just doing a rough computation. We require roughly 45 to 50 licenses to actually set up a hospital and get it functional. And all these 40, 50 licenses usually are 40, 50 discrete bodies that you actually need to go to within our regulatory system. And that by itself is really a minefield because none of the processes, unfortunately, are transparent and they can lead to huge project overruns in terms of cost and in terms of timing, and both effectively impact our ability to deliver cost-effective healthcare. So I believe that the government needs to be far more friendly to developing of the healthcare infrastructure in our country and enabling people who actually want to invest in this a very good and an easy playground for them to set up facilities and not really create a huge amount of issues. I think there's a lot which needs to be done.
Ameera, how do you see, this challenges in terms of PPPs and, what are some of the things, why do you think that PPP is not been successful in the health sector? What are some of the learnings that we can take home whilst it solves one issue where land or space can be made available at an affordable cost?
I think the challenge is really the way we look at it. We expect PPPs to work in the existing structure of governance that, government says, I've got this much infrastructure, I'll hand it to you. Without knowing my costing, without knowing the accounting, without knowing anything, I'm going to give it to you and ask you to run a PPP at the lowest cost because I believe healthcare should be a social subject and you should be not making profits and giving it on cost, from you to the people. So I think the whole construct around the conversation around PPP so far has not been one which can actually build a sustainable model for anybody in the future, be it a hospital, be it diagnostics, be it anybody. In diagnostics, the significant challenges we faced, as he mentioned for hospitals, is very opposite from what hospitals face. Actually, our barrier to entry is not CapEx. The capital investment in diagnostics is actually quite low. The bigger challenge is management. The bigger challenge is the construct of the industry, where it's 90% fragmented. There's absolutely zero regulation. There is no basic minimum standard for anybody to operate a PathLab. And therefore, it's a little bit of a wild west. It's a jungle out there. And genuinely, nobody knows what kind of quality of reports is coming out of even hospitals or nursing homes or PathLabs. So I think unless the government focuses their energy on just doing 3-4 things rather than being a provider of healthcare, if they move on to a payer model, where their job is just to facilitate financial coverage, where their job is to put ethical and structural regulatory reform, where their job is to do health awareness to the consumers and educate them on what differentiates good from bad and who's a preferred provider and who's not. And therefore, remove all the fly-by-night operators who are functioning today without minimum standards and actually spoiling the reputation of healthcare out there. Just to give you an example, if you look at Brazil as a health system, again, an emerging market in the 1960s, India and Brazil were actually at very similar places economically, as well as from health indicators point of view. And they actually went on this long reform journey that I started my conversation with, almost now for 40 years. And today, Brazil is way ahead of where India is, just because they've had a consistent strategy towards healthcare. And health has become an electoral subject. People vote based on which political party provides them good healthcare. I mean, where do you see this in India at all? It's not a conversation we even have during elections. And if you see today, Brazil has now gotten to a place where they're about 80 to 90% or 100% ahead of us on every health indicator. There's 100% insurance coverage. Every single person is covered for healthcare. I hope and I dream that there can be a time in India where we have that, where poor people are not put in a situation where they have to choose between bankruptcy and providing healthcare to their families, which is frankly a pretty sad situation.
So, Dr. Jairam, affordable healthcare and patient safety being major concerns, and like Ameera mentioned, how to make this quality healthcare, really at an affordable cost. Is that a possibility? Is there any relation? Is there anything that can be done?
Thank you, Jagruti, and good morning to everybody. I think it is fundamental for us to understand what quality brings. Step one would be for us to get appropriate and data that is honest, data that is correct from every healthcare institution and provider in this country. An analysis of this data would help us understand where focus needs to be. And in my opinion, this focus would be principally in the area of clinical quality delivery. This next step would then be a self-regulation by appropriate move on the part of the government towards self-regulation. And this indeed would be the way forward. It is fair to say that some steps have been taken by the government. The formation of NABH, for example, through the Quality Council of India. But the popularity of accreditation still remains far from where it needs to be. And this is because there is laxity and there is a failure to see the value of accreditation or of quality delivery. If we were to link this, for example, to compensations that are given or to other such mandates, then the road towards quality would move faster and move forward. Believe you me, this is one of the most important steps forward in the healthcare requirements of this country.
Dr. Manchanda, given that we are seeing different challenges, what do you think are, some of the different new business models that you see, and what has been the trends that you see in consolidation, and if you can throw some light on that?
At a basic level, there are two broad needs which need to be met. One is accessibility, especially bottom end of the pyramid virtually has no healthcare. Second is affordability. And there are 3 or 4 things which I actually have gathered over a period of time, that healthcare has been suffering because of supply side constraints. We don't have manpower, we don't have infrastructure. But I do see that now need has become so big that probably patients are going to get empowered and technology is going to play a big role. Second thing I see in India especially, the entrepreneurship is on a rise. A lot of management students who are coming out of the management institutes, I feel that most of them are actually want to become entrepreneur. And I see a big trend in medical field also, a lot of doctors wanting to become entrepreneur. And with the investments available now easily to all of us, and medical entrepreneurship on rise with enablers like IT, I see a complete disruption in the way healthcare will be delivered in future. In our own space, in diagnostics, I'm already seeing where anytime, anywhere concept is coming. People don't want to visit labs to give blood sample. They want all of us to go to their houses, offices to collect the blood sample, and the report is available online. So it's completely changing. It's becoming like WhatsApp, or all of us have apps where you can actually go and book your test online. So I see a big disruption coming in the business models.
So, Manoj, when we talk of technology, what are some of the concerns of the healthcare sector and that you think technology will help overcome?
Thank you, Jagruti, and good morning, ladies and gentlemen. Our investment in healthcare in India is abysmally low, just about 4 to 5% of our GDP, which compares rather poorly with the investment in some of the developed nations, which actually touches about 10% of the GDP. Again, out of this 4 to 5% which we are investing in healthcare, government investment is very low, just a little over 1%, majority of which goes towards either running the healthcare programs or building infrastructure or paying salaries to the healthcare staff. Very little is actually invested in technology. So far as information technology penetration is concerned, it's a meager 2% of the total investment which we make in healthcare. I think that speaks volumes about the seriousness that we are according to this sector. As a result, what happens is that we have a vast population which is either relying on self-medication or on over-the-counter drugs, or are visiting quacks, and which is ruining their health majorly. So far as affordability is concerned, just about 6% of the total expenditure that our patients incur on healthcare gets met out of insurance. So insurance penetration in healthcare also is rather low, and there again the population which stands in need of healthcare, so to speak, of our elderly, they are deprived of this benefit because they do not find it easy to get insurance policies. So I think that's another major challenge that we are facing. Telemedicine, another very important area. If the patients cannot reach the hospital, let the hospitals reach patients. But are we really ready to implement telemedicine? That's a very vast subject. We need to have good connectivity across the country. We also need to provide e-literacy to our vast population. We also need to have the right kind of infrastructure which should be available in order to take telemedicine across the nook and corner of the country. And finally, coming to the skill sets. So we have very good doctors in the country. Many of them are doing good service, but a great majority of them also are leaving India to take up jobs outside. So that's really a brain drain which is taking place. And the quality of staff in this Bharat is truly suspect. I was reading an article somewhere that in one of the remote corners of the country where you had medical facilities existing, out of the 65 nurses who were interviewed, only one was found qualified to do that job. So we either do not have good facilities, or we do not have qualified staff to take up those kind of assignments. I think these are some of the areas where technology can play a very significant role through a proper policy which the government can introduce by having a proper vision on how to promote healthcare in the country.